Hello everyone. So today I will be discussing typhoid fever. So I just pulled up my handout that I made here. So we'll get started. Typhoid fever is caused by the bacterium Salmonella typhi, and a couple of statistics here are pulled from the CDC website. Typhoid fever, it affects an estimated 22 million people worldwide each year. In the United States, about 350 people are diagnosed with typhoid fever each year, and most often after traveling outside of the United States. And then here are some signs and symptoms of typhoid fever. A sustained fever that can be as high as 103 to 104 degrees Fahrenheit. And then some other symptoms may include weakness, stomach pain, headache, diarrhea or constipation, cough, loss of appetite, and some people with typhoid fever or paratyphoid fever develop a rash of flat rose-colored spots. Then a sample of blood or stool tested for Salmonella typhi is needed to confirm the typhoid fever diagnosis. Then we'll go into the pathophysiology here. Typhoid fever is a life-threatening illness caused by the bacterium Salmonella typhi, which we already discussed a little bit above. Salmonella typhi live only in humans. When someone consumes a food or drink that is contaminated with Salmonella typhi, the bacteria can multiply and spread into the bloodstream, causing typhoid fever. So you can get typhoid fever if you were to eat food or drink a beverage that has been touched by a person who is shedding Salmonella typhi and who has not washed their hands thoroughly after going to the bathroom, or contaminated sewage gets into the water you drink, or contaminated sewage gets into the water used to rinse the raw food you eat. And then for prevention, you would take precautions to prevent consuming contaminated food and or water. But there's also vaccinations available against typhoid fever if you're planning on traveling outside of the United States. There are currently 3 typhoid vaccines that are recommended according to WHO. The first 2 are injectable, and then so the first one, an injectable, typhoid conjugate vaccine consisting of VI polysaccharide antigen linked to tetanus toxoid protein, licensed for children from 6 months of age and adults up to 45 years of age. And then the second one is an injectable unconjugated polysaccharide vaccine based on the purified VI antigen known as VIPS vaccine, and that is for people aged 2 years and above. And then lastly, there is an oral live attenuated TY21A vaccine in capsule formulation for those who are over 6 years of age. And then we'll go into the treatment of typhoid fever. Antibiotics are the standard treatment for typhoid fever, but there are some differences, and the different treatment options are related to resistance that is common in different areas. So if it's not acquired in Asia, then these would be the first line treatment. So the first one, either of the 2 would be a first line. So the ciprofloxacin, 400 milligrams IV every 12 hours, or levofloxacin, 750 milligrams by mouth or IV every 24 hours for 7 to 14 days. And then if typhoid fever is acquired in Asia, then the choices for antibiotics would include ceftriaxone, 2 grams IV daily for 7 to 14 days, or azithromycin, 1 gram by mouth for the first dose, then 500 milligrams by mouth daily for 7 days, or the third option would be chloramphenicol, 500 milligrams by mouth or IV every 6 hours for 14 days. And that is, both of those columns were for adults. Then if you are treating typhoid fever in children, The antibiotic of choice is azithromycin, 10 milligrams per kilogram, once daily for 7 days. And lastly, for severely ill patients, you can use dexamethasone. The first dose is just prior to antibiotic. That's 3 milligrams per kilogram IV, then 1 milligram per kilogram every 6 hours for 8 doses. And then I do have the pregnancy classes listed on the bottom here. So the ciprofloxacin, levofloxacin, dexamethasone, and chloramphenicol are pregnancy class C, but the ceftriaxone and azithromycin are pregnancy class B. And I believe that sums up the treatment of typhoid fever. Thank you for listening to my presentation.